going to get started with sharing my screen again and showing you guys the PowerPoint for today. Sorry, Bri, I didn't formally welcome you. Welcome to Healthy at Home, Monday edition. Today, we're speaking about the low back, AKA in medical terms, the lumbar spine. So, I need to get this in full view. Give me just a moment. Play from the start. Okay, now you guys can see better. Healthy at Home. You know, this is just educational. If you are in need of one-on-one care, you can email me or call me or text me at that number and we can set up an appointment. Or you can also see my colleague, Dr. Alejandra Martinez, who's also on my virtual team. So, lumbar spinal anatomy. So, first you look over on the left and you can just appreciate the whole spine. What I want to point out here is the changes in the spinal vertebral segments. So what is a vertebral segment? That is one of these spinal segments. So this is called a vertebra. They're stacked one on top of the other. You can see when you start at the cervical spine, going down through the thoracic spine, they actually start to get larger, right? So the lumbar spine vertebral segments are the largest, and they're there because the main function of the lumbar spine vertebrae are to bear the weight, right? So our center of gravity is at S2 segment level. S2 is the sacral segment. So that whole lumbosacral area is where we're bearing the most weight. Now you can also see in between each lumbar segment that there are discs. So everyone likely has heard of a disc. So these discs are cushions, they're shock absorbers, and they allow for weight transference, stress transference with different activities. Now, also want to point out that you can see that there's a curvature. There's a slight curvature in your lumbar spine. Now, they categorize different physiological presentations as normal and, atypical or abnormal. But honestly, having worked with many people over these years, there really is no true normal. This is just a reference point as to where we're working from. So they say that this curvature is a normal curvature, but how many people are normal and not? Most people have some different variation from this norm, majority. So you can also see in these lumbar segments that there's these little bony projections out the back. Those are called spinous processes. And these projections primarily are for muscle attachment and also for the different ligaments to attach onto. So last thing I want to point out is up here you can see this hole. This is where your spinal cord travels through. So if you were to look from the top on all of these segments, you would see this hole going straight down. And so that just allows the spinal cord to travel through. So I'm not going to do too much of anatomy today, but I just wanted to show this picture that I've showed in the past. Again, these images are from Netter's Anatomy Atlas, my favorite. So you can see the multiple layers of the muscles from the back view. So today we're mainly focusing on these lumbar muscles. What I want to point out is the fascia. So this white part here, this is the thoracolumbar fascia. It starts in the thoracic spine, goes into the lumbar spine, and actually inserts onto your sacrum. So this fascia is really important when dealing with low back dysfunction, and many times people will have fascial restrictions in this area that are limiting their movement and their function. But you can see they cut back some of the muscles here. You can see the erector spinae muscles. As the name implies, it helps you stay erect. And then I believe they cut through, so they cut through so that we could see the external oblique, the internal oblique. I see the obliques over here. And then deeper, you would see the lumbar multifidi muscles and the quadratus lumborum, which are also important lumbar muscles. So just bringing it back to, we spoke about the core a few weeks ago. Remember that the core is 4 muscle groups. So it is not just your six-pack, your rectus abdominis, it's actually deeper muscles. So the transverse abdominis, lumbar multifidi muscles, those are in the back, the diaphragm, and the pelvic floor. The core itself, the function is to work as a hydraulic amplifier. And so everything that those muscles are doing, they're coordinating stability in your lumbar spine, in the abdominal pelvic cavity, to maintain the intra-abdominal pressure and to protect the organs and just the spine itself. So when there is, when intra-abdominal pressure is not balanced, that's when dysfunction can occur. So you can have urinary incontinence, low back pain. Today we're mainly speaking about the lumbar spine in the back. So low back dysfunction, this is not an all-inclusive list. I just listed some things that people are familiar with. So low back dysfunction, you could just have generalized low back pain. You don't necessarily have a disc herniation. You don't necessarily have all those other diagnoses. You could just have a generalized non-specific low back pain. You can have stenosis, spondylosis, spondylolisthesis, fun words, scoliosis. Most people have heard of scoliosis. That is a change in the torsion of your spine. That's a little more complex to get into, but those are some diagnoses that can cause low back pain or are involved in the lumbar spine. Lumbar spine treatment, physical therapy wise, I always like to start with some kind of hands-on release when I'm doing in-person work, but you're able to achieve a good amount of myofascial release just by using different balls. There's tons of myofascial balls and tools that they've created so patients can do a release at home. Stretches, strengthening of the core. I see a typo there that's supposed to say Pilates rehabilitation, postural re-education, and of course, habit and behavior modification. Because if you're doing all these exercises in physical therapy, but you're not carrying that over to your everyday life, then you're not going to get the full benefit of the treatment. Behavior modifications. So this includes ergonomics at the desk, at the workplace. How are you sitting? If you have a desk job, are you sitting in a chair that's too high? Are you slumping? Are you sitting all day and never getting up? Posture is really important for that. We've gone over that in the early weeks, healthy at homes. And then something important is core integration with all functional activities. So say if you are, I remember I treated a gentleman who was a mover, like he worked for a moving company, and he started to develop this low back pain, and his mechanics were off. He wasn't breathing. Remember, the diaphragm is one of the main, one of the 4 muscles of your core. And so we just worked on foundational retraining of core integration, getting the diaphragm, the pelvic floor, the transverse abdominis, and the lumbar multifidi engaged. So, and then he was able to have no back pain and go back to work pain-free. So that is a success story. So, okay, so now we're going to stop the screen share and go into some exercises. So I'm going to angle this down so you can hopefully see me. We're going to start on the mat again today. So if you want to follow along, you can. These are just general recommendations. Again, if you have any acute back pain, you should definitely schedule a one-on-one. But we're going to start on our back. So laying down here, we're going to warm up those core muscles. So we're going to start first with the diaphragm. If you put one hand on your chest, one hand on your belly, you're going to take a big inhale through your nose, breathing in and out, and in and out. Again, in and out, in and out. Okay, now let's bring both hands to the belly, and we're going to change the exhale to make it an audible S hissing exhale. So you'll inhale And exhale. Again, inhale. And exhale. As you're doing that S exhale, notice if there's a change in the muscle tone in your lower belly where your hands are resting. Do that 2 more times. Inhale and exhale. So you should feel a slight tightening at the end there. 1 more time. Inhale and exhale. Great. Okay, now we're going to bring our hands to our rib cage. So to the sides of our rib cage, our elbows will be pointing out. We're just going to do 1 more diaphragm warm up. As you inhale, breathe outward into your hands. Inhale. Exhale, let's fog the mirror with our breath. That will sound like do that 3 more times. Inhale. Exhale. 2 more. Inhale. Filling up the diaphragm, filling up those lungs. And exhale. 1 more. Inhale. And exhale. Great. Okay. So the next thing we're going to do is gain some orientation as to where our pelvis is in relation to our rib cage. This is called neutral spine education. So learning where neutral spine, neutral pelvis is. You're going to make a triangle with your hands, and you're going to place that triangle down on your pelvis. The heels of your hands should rest on your hip bones, and then your pointer fingers should rest on your pubic bone. As you inhale this time, gently allow the pelvis to rock towards your feet. You might end up with a slight arch in your back. That's okay. And then exhale, curl the tail under, rock the pelvis towards you. Imagine like someone's pressing down into your belly and you feel that belly going back towards your spine. Again, inhale, rock the pelvis towards your feet. Exhale, feel the belly going down towards your spine. 2 more times, just loosening up your low back. Also just feeling the motion. 1 more time, inhale and exhale. Okay, so let's just take 1 more pelvic tilt, rocking towards your feet. Noticing how far you can go in that direction, and then rocking towards your face. Noticing how far you can go in the other direction, and then try to find the middle ground. So that will be the midpoint in between those 2 endpoints. That will be your neutral pelvis. This is the safest position to work for rehabilitation from back pain, or just in general when you're recovering from any injury. So this is what I call phase 1. So we'll be staying in neutral pelvis. You're going to stay in the neutral pelvis position. Take 1 big belly breath. Exhale. Notice if you can keep that pelvic position. Inhale and exhale. Good. Okay. Now from here, to maintain this neutral pelvic position, we're going to challenge ourselves by moving our legs. So we're going to start first with our inhale, feeling that expansion in the diaphragm. As you exhale, let's engage the pelvic floor as well as your deep transverse abdominis. And think of lifting in those pelvic muscles that run from your pubic bone all the way towards your tailbone. This would be a Kegel. If you have pelvic floor dysfunction or pelvic pain in the moment, obviously, please don't do the Kegel or pelvic floor engagement. So we're going to inhale, exhale, engaging your pelvic floor and your deep abdominals, and then allow the right leg to open out to the side. Only open the leg maybe like 4 inches, 3 to 4 inches, or as far as you can keep your pelvis level. Now inhale here, feel the expansion. Exhale, engaging your pelvic floor and your abdominals, and pull the right leg back up to the ceiling. On the next exhale, we're going to open the other leg, your left leg, out to the side. Good. Inhale here, exhale again. Engaging your pelvic floor and your abdominals, pull the leg back up. All of these exercises are very basic and foundational because you need to have mastery in these foundational exercises before you can move forward into more challenging exercises. So let's do that one more time, right and left. Inhale. Exhale, pelvic floor and transverse abdominis engage as you tilt the right leg out to the side. Notice if your hands are still on your pelvis, if you feel one hip bone tilting. If you feel that happening, then just bring that leg up a little bit more so that you can maintain that neutral level pelvis. Bring the leg back up, and we'll switch to the other side. Inhale. Exhale, engage in your pelvic floor and your deep abdominals. Open the left leg out to the side, only as far as your hip bones and your pubic bones stay level. Bring it back up and rest. Okay, so the whole idea there is that your pelvis is staying level. So that triangle, the pelvic triangle with your hands is a reference for you. Ideally, your hip bones and your pubic bone should be on the same level. It should be like a flat plane. That would be maintaining the neutral and disassociating in your hip. We're going to now challenge ourselves by coming over onto our sides and then onto our hands and knees. So we were on our hands and knees last week for the scapula. So let's be sure that you have that same chest lift and that gentle press through your arms to keep the shoulder blades nice and wide. Your spine should be long and straight. Imagine that you're balancing a bowl of soup on your low back. So we're here. We're going to take that breath. Inhale. This time, try to feel if you can expand the back ribs up to the ceiling. Exhale, engage in your abdominals. And repeat that again. This time as you exhale, slide the right leg back on the mat behind you. Your toes stay on the ground. Now, did you spill any soup on your low back? I hope not. Let's bring the knee back in. That's your lunch for after this, guys. You don't want to spill that. Inhale. Exhale, engage in the abdominals. Slide the left leg back. You may notice that one side is more wobbly than the other. That's normal. Bring the leg back in, and we'll switch to the other side. Inhale. Exhale. Right leg slides back. And bring it back in. One more time on the left. Inhale. Exhale. And bring it back in. Good. Okay, we're going to come back up to sitting. So that last exercise on the hands and knees was getting your lumbar multifidi muscle engaged in your core activation. So as a quick review, sitting posture. Remember, we've done this in previous sessions, but since we're speaking about the lumbar spine, and we just did all that stuff on your, I think you can see me now, okay, on your back and on your hands and knees, let's find neutral pelvis, neutral spine in sitting. This is that transition to behavior modification, ergonomic retraining for the desk place so that someone who has back pain can fully recover. So hands on the hips first. You're going to start by just rocking your pelvis forward and back, just like you did when you were on your back. As you do this, notice if you can feel your sit bones. Those are those bony prominences that stick out from the butt cheek region. And then you're going to stop when you're right on top of your sit bones. Okay? And then we're going to take that position like 10 degrees, a little bit more forward so you'll feel your pelvic floor engage. So from there, you're just going to slightly rock the pelvis forward, and then you'll feel those pelvic floor muscles kick in. Okay, so now your pelvis is set. Let's check in with the rib cage. The rib cage, if you think of it like a package or a box that's hovering over your pelvis, you want to get that box hovering directly over the pelvis. So go ahead and put one hand on the front of the rib cage, one hand on the back, and try to find that position with the rib cage right over the pelvis. Okay? And then you can bring your hands back down. Let's roll the shoulders back and down. And then just bring your head back in space slightly. Most of us have that slight forward head because we all have some kind of smart technology, right? If it's our phone, if it's our laptop. So make sure that that head is back in space right over the cervical spine. And then your chin should be parallel to the floor. Right now, my feet are flat on the ground. I have a 90-degree bend in my knees. And so that would be that ideal neutral spine posture in sitting. You could do the same breathing, the same pelvic floor and abdominal activations if you want, but for everyday life, sitting activities, if you just align the bones where they need to be, the proper amount of muscle activation will happen naturally. So, okay, so that was lumbar spine part 1. On Friday, I'm doing lumbar spine part 2. I decided to just do the same thing for the entire week because I got a lot to say. And I'm just gonna bring it back now to a screen share so you can see the end of the PowerPoint. Okay, so core integration, postural corrections, ergonomic at the desk. Let's see. That's right, okay, so you guys know, Monday and Friday, 30-minute, open to everybody. If any friends or family members want to learn some stuff about the lumbar spine, tell them to come on Friday. I'm teaching my virtual Pilates class Tuesdays at 11. The Pilates intermediate class, we moved the time to 6 p.m. so more people could attend. So that happens every Wednesday. And then I'm still doing the PT evaluations, follow-ups, and one-on-ones, as is Dr. Alejandra Martinez. I wanted to also just point out that I have a webinar specific for Pilates for back pain and scoliosis and disc herniations. This has a lot of information, so if you are curious to learn even more about scoliosis and disc herniations, you can send, and that is another typo, so that should say inspirapt.com. So hello@inspirapt.com, call or text, or you could just visit the website to sign up. It's $60. It's a little bit less than 2 hours. And the video recording is from a live in-person workshop. So it's super informative. If you have scoliosis and you want to learn to understand it more, if you have disc herniations and you want to learn about, how you might be able to help yourself, it's super informative. So anyway, this is the correct email, address, website. Instagram Live series is starting May 26th. I'm super excited for it. It will feature a lot of different experts in medicine, Pilates, wellness, some acupuncturists, so it will be very good. And that is it. Thank you guys so much. And I just want to take the last few minutes as usual to answer any questions. So I'm going to stop the share. Okay. Hello.
That's great. Thank you, Melanie.
You're welcome.
I'll reach out to you for a one-on-one.
Okay.
I'll get back to you. Okay.
Sounds good. No problem at all. Any questions?
Do you have anything? No? Okay.
No.
Good.
Okay.
Good.
Part 2 is on Friday.
Great. Thank you so much.
Okay. Stay safe, guys.
Goodbye.
Bye-bye.